Hi everyone, and welcome to the short video on cohort and case control studies. We're going to be comparing both of them using two different case studies. This is as part of an assignment from Oklahoma State University Center for Health Sciences, the MPH 5323 General Epidemiology course, and I am Jeremy Kaplan. So the first thing that we're going to do is compare cohort and case control. What I have for you right here is a nice table with comparative terms used for both cohort studies and case control studies. But taking a look at this table, we can see that advantages of case control is that they're efficient, they're flexible, they reduce selection bias and reduce information bias. Disadvantages include the reduced power because you have a reduced sample size with this particular type of case control. When we're taking a look at advantages of cohort studies, similar to case control study designs, they're also efficient, flexible, they reduce selection bias, reduce information bias. Other advantages when compared to case control studies is that the subcohort can be used to study multiple outcomes. The risk can be measured at any time up to T1, and the subcohort can be used to calculate person time risk. Whereas disadvantages of case cohort studies include, as compared to case control study designs, increased potential for information bias because the subcohort could have been established after the T0 exposure information collected, or it could have been done at different times. The first epidemiological study that we'll go over is for case control, and the study investigates healthcare disparities amongst individuals with comorbid schizophrenia and cardiovascular disease where both national health insurance and a comprehensive rehabilitation law for persons with mental disabilities exist. This case control sample had over 52,000 participants of service users, and of those 52,000, over 8,000 with cardiovascular disease were compared to those with and without schizophrenia on drug utilization, laboratory tests, specialized visits, and intervention. Based off the results, in countries like Israel, with national health insurance and rehabilitation laws specific for persons with mental disabilities, service users with schizophrenia still failed to receive equitable levels of health care for cardiovascular disease. However, these disparities appear to be smaller than in other countries with universal health insurance. When we take a look at Americans living in rural areas are more likely to die from unintentional injuries, heart disease, cancer, stroke, and chronic disease than their urban counterparts. These health disparities account for significant costs in states and communities, which is a big issue economically. Even when health insurance and access to care are accounted for, disparities remain. Disproportionately, poor health outcomes in areas such as infant mortality, life expectancy, and prevalence of chronic disease reveal differences by race and ethnicity that are independent of other factors. The next epidemiological study that we'll go over is of the cohort method. This study aimed to determine if job loss during COVID-19 pandemic is associated with mental and physical health and if social interactions and finances moderate the relationship between job loss and health. For this method, again, this was a cohort study, and it included Australians 18 years and older employed prior to the COVID-19 pandemic who responded to an online or telephone study between March 27th and June 12th of 2020. And of the people that responded, this was 2,603 participants. Outcome measures included the Kessler-6 score for psychological distress and the SF-12 mental health or physical health component score indicating mental or physical health. The groups included job loss, not working, but remained employed, working less, and work unaffected. And based off the results, losing work during the COVID-19 pandemic is associated with mental and physical health problems, and moderated by social interactions and financial resources. Increased financial security and enhanced social connection may relieve the health impacts of job loss. Public health aims to promote healthy lifestyles as well as detect, prevent, and respond to disease. The prevalence of mental health issues that affect individuals' physical and social well-being makes dealing with mental health integral to achieving public health goals. Thank you so much for your time.